Clear Choice has been in existence since the late 90s. It has evolved over a small laser center to a new high-tech, new modern facility that really embraces the patient's comfortability, embraces technology, gives that to the patient in an affordable, efficient way.
Our goal with the Cleveland Eye Clinic has been to try to make it a center of excellence, and so we've always believed in trying to simply be able to have access to the most advanced technologies.
Well, it's always been exciting, but the excitement changes as the technology changes. So throughout the years, you have a lot of new innovations over the last decade when it comes to refractive surgery.
We would like to take it one step further by going ahead and getting involved in the research arena, where we can go ahead and have access to certain technologies that may not be available at this point in time to the average ophthalmologist. And this will give our patients the opportunity to have access to certain technologies that they may not have otherwise had. I think one of the biggest developments that's occurred is Orange technology. Orange technology is a new device. It's been around for about 2 or 3 years, and it's very limited as far as who has access to it. In the state of Ohio, we are one of 2 centers that have access to this device. And the beauty about this is it's able to customize things in real time and work sort of like a GPS for the surgeon. It allows us to guide the patient and determine what implant would be best to optimize their overall vision. The studies that we've looked at basically have found that our results are much more precise if we utilize Orange technology as opposed to not using Orange. There are patients that have a condition known as keratoconus. This is a degenerative condition where the patient's vision progressively becomes worse. And in the past, all we could do is just hope that the vision did not get much worse with this condition. And when the patient's vision got bad enough, we would offer them a corneal transplant. Now we have access to a procedure known as corneal cross-linking, and the beauty about this is that it is able to go ahead and freeze the patient's vision and prevent it from getting worse. You have a one-time treatment using vitamin light therapy, and with that we're able to prevent further progression. So this is going to be revolutionary for patients as far as trying to improve their condition. Before, the concept was just removing the cataract and just having the patient see, but now we've combined cataract surgery and refractive surgery, so our goal these days are where we can improve the patient's vision to a level that they may have never achieved in the past.
When I had it done in the early 90s to where it is today, it's almost like taking the seat belt and the new technology of airbags. The safety is great, it's a new dynamic, and when I had it done, yeah, it was great and effective, but certainly the outcomes today are much greater than it was back a decade ago.
Everyone works as a team. Everyone goes ahead and goes the extra mile to try to make patients feel as comfortable as possible. I think if you talk to most of our patients, it is incredible how excited they are even several years out as far as their experience at Clear Choice.
You want to make the patient experience comfortable, yet efficient, and maintain the safety and accuracy that we're looking for. So it really comes down to the patient, taking care of the patients, all their needs from top to bottom.
It is impressive the impact you can make to a patient's quality of life. I mean, for me, one of my most favorite days is seeing patients the day after any type of procedure and seeing what impact that you've made as far as their quality of life is concerned. It's really hard to put a price tag in.
The biggest satisfaction in my job is getting rid of a handicap for the patient, because a lot of people walk around with terrible prescriptions and rely on their glasses and contact lens for all daily activities. And by alleviating that type of handicap for that patient is extremely gratifying.
The best part of being a Clear Choice is, besides giving patients this great vision, you can go ahead and give them an experience that is second to none.